Chapter 27 focuses on functional behavior assessment. Many of you have already had the FBA 510 course where functional behavior assessment was the main focus. For those who have not had that course, don't worry too much about the details of this section. For this class, we'll only breeze over the main points of this chapter. All of you, however, should spend some time reviewing this material. The chapter is very well organized, but pay particular attention to the case examples illustrating the FBA process that begin on page 643 of the textbook. I think all of you will find that quite helpful. So with that, let's get into some of the basics of functional behavior assessment. Those who had the FBA 510 course know functional behavior assessment as a set of procedures for defining events in the environment that reliably predict and maintain behavior. And when we talk about conducting a functional behavior assessment, the majority of time it is on problematic behavior. That is, behavior that interferes with learning or perhaps causes harm to the individual or other people. So let's start with our three-term contingency. When we analyze behavior, that is any behavior, so adaptive behavior or problematic behavior, we do so using a three-term contingency. So we ask ourselves, or we try to observe, best case scenario, the antecedents and the consequences that are in close temporal proximity to the behavior. That's not to say that antecedents that occur sometime in the past or consequences that will occur in the future can't have an impact on behavior, but many of the times we are looking at close temporal proximity. So what happened just before the behavior, what happened after the behavior. So the consequences that maintain behavior, all behavior, are reinforcing consequences, right? So we think of behavior as operating on the environment and it produces some effect on the environment. The effect that is produced is what we refer to as a consequence. If that consequence is reinforcing, the behavior will be strengthened and maintained. So there are four sources or four functions of behavior, right? These are the reinforcers that maintain behavior. So let's change the focus and only talk about problematic behavior. Again, things that interfere with learning or cause harm to self or others. So behaviors like property destruction, self-injury, aggression, disruptive behavior, elopement, the list goes on. So the four functions that we try to identify via a functional behavior assessment are social positive reinforcement in the form of gaining access to attention or gaining access to a tangible item. Social negative reinforcement in the form of avoidance or escape from aversive conditions. Automatic positive reinforcement, sensory stimulation, and automatic negative reinforcement, pain attenuation. So these reinforcers can be sort of broken down into the category of being social, right? Social positive or social negative, meaning that the reinforcer is controlled or delivered by another person, whereas automatic reinforcement is produced by the behavior itself. So when we look at these subcategories of attention and tangible, what we're referring to there is a situation in which let's just say a student engages in problematic behavior to gain access to maybe the teacher's attention, or maybe they're gaining access to their parents' attention, or the attention of another student. Or they may be engaging in problem behavior to gain access to something they want, right? So classic example of the child in the grocery store tantruming to gain access to candy. In social negative reinforcement, what's happening again is that the problematic behavior is producing a consequence that removes some aversive condition. So the student may engage in problematic behavior to get out of doing work maybe they're engaging in problem behavior to get out of a test, or they're avoiding the introduction of the aversive event. So engaging in problematic behavior when the school bus shows up so you don't have to go to school. Okay. Automatic positive reinforcement, we call that, we refer to sensory stimulation. So you might see individuals who engage in repetitive behavior like hand flapping, or even some forms of self-injury like ear clapping or poking the eye, might produce some sensory stimulation that is reinforcing. Whereas automatic negative reinforcement is that the problematic behavior releases endorphins that attenuate pain elsewhere in the body. So for example, the individual may have a toothache, but if they cannot communicate that they have a toothache, perhaps banging their head releases endorphins that attenuate the pain of a toothache. So what we're trying to do with our functional behavior assessment is identify which of these is maintaining the problematic behavior, right? So the behavior is only occurring because it is being reinforced, and it's going to be reinforced by one or more of these reinforcers or functions. Generally, we see it's typically only one, but that said, there can be behavior that is multiply maintained, so maintained by more than one source of reinforcement. So we're going to analyze the behavior, and the best way to do that is by observing behavior environment interactions, right? And there are steps involved that we've covered in other courses, but briefly, we want to identify and operationally define the target behavior. Then we want to establish some system to measure that behavior. So are we going to record the frequency of it or the duration? And then, of course, we need to set up observation times, right? So what are we going to do during the observation? Are we going to observe in the classroom? Or we can actually contrive environmental events. So let's save that for now. So once we're able to record the target behavior and record environmental events, those we suspect influence the behavior, in a good analysis, we would manipulate the suspected controlling variables, right? So that's what I mean here by contriving environmental events. So if, for example, we hypothesize based on preliminary information that the individual engages in problem behavior to get out of doing schoolwork, we could conduct an observation or a session where we deliver schoolwork. And then contingent on problem behavior, we introduce some consequence. Again, we're trying to test what function influences or maintains a problematic behavior. So the functional behavior assessment is the process by which we do that. And it is a set of procedures. It's not just one thing. It consists of a couple different approaches. But an FBA comprehensively is a set of procedures for defining events in the environment that reliably predict and maintain behavior. So again, we're looking at these antecedent conditions that seem to occasion problem behavior, and then we're looking at the consequence events that seem to maintain the problem behavior. And of course, we could look at the frequency of problem behavior in the presence versus absence of these two events, the antecedent events and the consequence events. So the main goal of the FBA is to identify the behavior's function. That is the reinforcer that's currently maintaining the behavior. Once again, if a behavior is occurring, it is being reinforced. So we could look to the environment to determine what that reinforcer is. Once we know what the reinforcer is, then we begin to design an intervention to change the behavior. And if it's problematic, that change is going to be to reduce or eliminate the problem behavior. So once we know what the controlling variables are, we can actually manipulate those and hopefully eliminate the problem behavior. The three approaches to a functional behavior assessment include an indirect assessment, descriptive assessment, and a functional analysis. Now, The textbook begins with functional analysis and then moves into descriptive assessment and indirect assessment. In fact, that is how I taught the ABA 510 course. Here, I'm listing them in a sequence in which they might be done in a clinical situation. So that is, we're going to start with an indirect assessment. We may or may not move to a descriptive assessment, but we are definitely going to end with a functional analysis. So what is an indirect assessment? The indirect assessment is an approach to gather information about the problematic behavior and the suspected controlling variables through means other than direct observation. So this includes record review, interviewing teachers, parents, and caregivers, and maybe completing checklists or using rating scales or more structured interview tools. And the strength of this is that it's pretty easy to do, right? So if we want to understand a student's problem behavior, reviewing their records might be a window into how often the behavior occurs, what specific behaviors occur, maybe even some of the controlling variables. If we interview teachers or parents or caregivers, folks who know the individual well, that gives us even more information about, again, the problem behavior and the conditions under which it occurs versus it does not occur. The major weakness, however, is that all of this information is subjective, right? We are not observing the behavior. Therefore, the information has questionable reliability and validity. Nevertheless, this is step one in a behavioral consultation. So when we are called in to address problematic behavior, we are going to begin with indirect assessment methods. And again, the goal here is to just simply gather background information, identify the target behaviors, begin to formulate operational definitions of those target behaviors. So how do we define them? Determine the intensity and the frequency of the behavior, ultimately generating a hypothesis about the function that we can later then test. And there are other things involved as well. So we're clearly going to begin with some interview. Now, again, we go into this in greater detail in the ABA 510 course. I'm not going to spend too much time with that here. After we've done some record review or interviewed, then we are probably going to use a structured interview tool. And there are many of them. The textbook lists some. I'm not sure if I have them all here, but some of the common ones are the motivational assessment scale, the functional analysis screening tool, the questions about behavioral function, and the problem behavior questionnaire. Now, again, we use these to further develop our hypothesis about what is maintaining the problem behavior. As mentioned, all of these tools are subjective, right? We're not actually observing problem behavior. We're just asking somebody who has seen the problem behavior, who knows a client well, if the problem behavior occurs under a variety of conditions. So these tools all have very significant inherent limitations. Nevertheless, they can be useful for structuring the type of questions we ask in an interview. So I'm not going to go through all of these, but I will highlight the functional analysis screening tool, particularly in the ABA 510 class. So the practical implications of indirect assessment are basically this, that indirect assessment is always the first step in a functional behavior assessment. We're always going to interview people who know the client, who have seen the problem behavior, and we're always going to review any records that are available. The structured interview tools like the FAST are helpful for gathering information and further developing a hypothesis, but none of this is sufficient to develop treatment. We have to observe the behavior further, we have to test our hypothesis about what's maintaining the behavior. And the only way to do that is to conduct observations and gather more data. So another step in the functional behavior assessment process is using a descriptive assessment. Now, again, we don't always have to do this, but it can be helpful. We could just move to a functional behavior assessment, functional analysis. But nevertheless, a descriptive assessment is another FBA approach. Here, we are going to engage in direct observation. And while doing so, we're going to record the behaviors. We're going to record the antecedent conditions that preceded the behavior and the consequences that follow the behavior. And we do this in naturalistic conditions. So this is sort of the fly on the wall example, where if we're consulting to a child in a classroom who's engaging in problem behavior, we're going to hang out in the back of the class and simply observe what goes on and collect some data. The data that are collected can be in a narrative form, just simply writing a demand was delivered, child eloped from the classroom, teacher's aide chased after the student. Right? We could write that down. That information tends to be pretty hard to analyze quantitatively. So I prefer, and I'll show you an example of this, a more structured recording system. Scatter plots, which are described in the textbook, are also useful for identifying time periods across the day in which problem behavior occurs. So a descriptive assessment is better than an indirect assessment in that we actually do have some direct observation and we are collecting objective data and we're trying to quantify it in some way. The major weakness, however, is that this approach is only going to identify correlational relationships. What I mean by that is if we observe a child bang his or her head on their desk, chances are the teacher is going to provide some form of attention, right? Because they have to. They have to address severe problem behavior like that. That's not to say that that is the reinforcer that maintains the problem behavior, right? It's only occurring close in time. It's sort of equivalent to if somebody sneezes, somebody else is bound to say bless you or gesundheit or some variation thereof. So it's only a correlation. The only way to determine if the events are causally related would be to do an experimental analysis, which we'll talk about shortly. So here is an example of a structured descriptive assessment data sheet. So we could list the target behavior up here and indicate the date in which the observation is occurring and the time. And we might include the frequency of problem behavior. So let's just say we're recording behavior of SIB. And we see that it occurs once. We're going to think, well, what just happened? And these responses, these antecedent responses, are coded. So down here, I see that presented with instructions or tasks, or once something can't have it. I apologize, the formatting is a little bit off here. Various antecedent conditions, and these could be modified to the particular setting. Well, let's just say when I saw this SIB occur, what actually happened was the teacher presented tasks. So I circle that, and what happened after the self-interest behavior occurred? Let's just say I saw the teacher provide verbal attention. So I'd go through the day doing this. Maybe there's 3 SIBs that occurred here and something different occurred. Let's just say it was a change in activities, right? 5, and then let's say, again, verbal attention is provided. So we need to collect enough of these data to ensure that we could observe a pattern, and more than likely, some pattern will emerge. That is, we'll see that 1 or 2 antecedents frequently precede the behavior, and perhaps 1 or 2 consequences frequently follow the behavior. So here's an example of some completed data sheets, right? So I'm highlighting items that seem to be of a particular class of antecedent condition: a transition, a writing task, a transition, and again, an academic task. We see problem behavior occurring here. I shift to the consequence side, and again, I see classes of a consequence. Teacher escorts child, teacher directs student to timeout, gives a break, directs student to timeout. So if we go back and think about the 4 functions of behavior and analyze in terms of the data that were provided, it seems that the problem behavior is occasioned by demanding type of events, right? A transition could be considered demand, writing is demand, math is demand. And the consequence is that the child seems to escape or avoid the work, right? Here, the teacher escorts a child. So what I mean there is physically guides a child, right? So they don't have to actually do the transition. The teacher moves them physically. Here, the teacher sends a student to timeout. So they've escaped the writing task, right? So this is the way we're analyzing these data. And we're going to do a comprehensive or quantitative analysis and graph these data with an attempt of trying to understand what antecedents most precede the problem behavior and what consequences most follow the problem behavior. So you can see the data graphed here, right? So that's an example of a descriptive assessment, and they can be quite useful. In fact, they definitely are better than an indirect assessment, but they do suffer that limitation of they only identify correlations. So the best case scenario is that you will test your hypothesis that you've developed based on your interview and record review and indirect assessment tools, and you will test it using a functional analysis. Okay, so this is sort of the main focus of the ABA 510 course, and it's one of our main approaches to assessment of behavior. In this case, problem behavior. So functional analysis is part of a functional behavior assessment. We're going to call it an analysis. It's sometimes referred to as a experimental analysis because we are going to manipulate the suspected controlling variables. So the characteristic is identification of functional relations through manipulation of the suspected controlling variables, right? So if we have information that suggests demands occasion problem behavior, then we should be able to deliver demands and see that problem behavior occurs. Okay, that's sort of one end of the continuum. If the parent often provides attention for problem behavior, and we see a lot of problem behavior, we should be able to provide attention contingent on problem behavior and see an increase in that behavior. Okay, so the functional analysis, you consider the session, if you will, the observation, one in which we are going to contrive conditions and manipulate controlling variables. So we need to set up a test condition or several test conditions versus a control. So if we stay with our example of self-injurious behavior, we need to compare conditions that self-injurious behavior results in some form of reinforcement versus conditions where self-injurious behavior does not result in reinforcement. That's sort of a crude example, or the most basic unit of a functional analysis. The major strength here is we are identifying a functional relationship between behavior and the environment. The weakness is that this approach is seen as complex, right? That not just everybody can do it, but all well-trained behavior analysts can do a functional analysis. That's sort of a topic for another course. So the most basic, or I guess the most comprehensive functional analysis protocol was developed by Brian Iwata at the University of Florida, and he was my graduate advisor. The functional analysis protocol consists of three experimental conditions, really, 3 test conditions: attention, demand, and an alone condition. and one control condition, the play. So in each of the test conditions, we are going to test problem behavior sensitivity to a particular source of reinforcement. And to do that, we are going to contrive conditions, right? So we're going to observe the client's behavior in each condition. Let's just say we're going to observe them for 10 minutes. So in that 10 minutes, this refers to establishing operation. In the attention condition, we go into a therapy room with the client and we say, hey, Johnny, I have some work to do, but you could hang out over there at the desk. So the EO is, I'm not delivering any attention to the client. If problem behavior occurs, so here we're going with the example of SIB, but it can be any problem behavior, we're going to deliver brief attention. Hey, Johnny, don't hit yourself. And then, we go back to work. If he hits himself again, we keep providing attention. So what we're doing is we're delivering the suspected or a suspected reinforcer. So we're testing the behavior's sensitivity to social positive reinforcement in the form of attention. We can actually modify this condition where we deliver a tangible item. Okay, that again, topic for another course. Then after we conduct that condition, we go to a demand condition. Here, the condition is meant to simulate a situation where particular demands are delivered. So if our interview suggests that academic demands may occasion problem behavior, we're going to deliver academic demands. So the therapist delivers the demands contingent on problem behavior. We're going to provide brief escape. Demand materials are removed. Client gets to take a 30-second break. And then we repeat that process. So that is a test for social negative reinforcement. Let's move down here to the alone. In the alone condition, the client is sent into the therapy room without any materials, and the therapist is not present, so there are no social consequences and no source of external stimulation. Therefore, if we see problem behavior occur there, we might suspect that the problem behavior is maintained by automatic reinforcement. That is, the behavior itself produces the reinforcer. Again, because there are no social consequences in this condition. All of these three conditions rather, are compared to the control condition. So the control condition should be one in which there is no establishing operation for problem behavior. How would we achieve that? Well, we would deliver continuous attention. We would not have any demands present in that session. And we might have the client's most preferred items. And that is a control. So we shouldn't see any problem behavior in that condition. So once again, these are observations. We refer to them as a session, and they could be very brief, anywhere between 5 minutes or 10 minutes. We're recording the target behavior. So we're collecting data on how often the target behavior occurs in each of these conditions. And we cycle through these conditions, graphing our data until we see clear results. So if we were to graph these data, well, let's look at this. A functional analysis graph might look something like this, where sessions are along the x-axis and responses per minute are on the y-axis. So again, folks in ABA who had ABA 510 and ABA 502 should be very familiar with this, but this is a basic line graph. So looking at the behaviors per minute, we see that problem behavior occurred at fairly high levels in the attention condition, right? So that leads us to conclude that problem behavior must be sensitive to social positive reinforcement because that is contingency tested here. Now, just to sort of review these graphs in a little more detail, yes, problem behavior occurred here and here in the alone condition, but when we look at the trend we see it decreasing over time. So that's not uncommon in a functional analysis. Let's look at a second set of functional analysis data. And I will point out that every time you do one of these assessments or analyses, the data will probably look different for each individual, that is. So again, sessions on the X, responses per minute on the Y. These data are showing elevated levels of responding in the demand condition. So that indicates that the behavior is occasioned by delivery of demands and maintained by social negative reinforcement. And this last graph here shows an example where problem behavior occurs in the alone condition, right? Particularly, again, relative to the other conditions, but we're really using this play as a comparison. So, problem behavior seems to be automatically maintained. Now, it's important to note with a functional analysis, we are not differentiating between automatic positive reinforcement and automatic negative reinforcement. That can be very hard to do because we do not have access to the reinforcers. That said, there are some occasions where we could extend the analysis to sort of try to tease that apart. So that is a primary functional analysis protocol. Now, that said, functional analyses are designed for each individual based on the interview, maybe based on preliminary observations. The goal is to conduct an assessment that is comprehensive and will get at the function of the behavior, but does not take a lot of time, right? Because the longer a person is in assessment, obviously there's a little more risk to injury of self and others, and we need to move on to treatment. So therefore, a variety of variations have been published in the literature showing ways in which we could abbreviate the functional analysis. While many of these approaches are useful in some settings, they all run a risk of missing the function, right? So that is, if we try to take shortcuts, we might not identify the function. So you have to use these very carefully, right? If the indirect assessment data are very clear and comprehensive and your own observations suggest a particular function, then we could take some shortcuts. So some of those might include conducting a brief functional analysis, where instead of running 10-minute conditions, we run 5-minute conditions. Instead of running 3 test conditions like the attention, demand, and alone, maybe we could reduce a number of conditions. So for example, if our interview data suggests that the problem behavior seems to be maintained by attention, then we might be able to just run the attention condition versus the control condition, right? So we've taken a shortcut. FAs have been done in a variety of settings: school settings, clinic settings, home settings. There is a trial-based approach. I'm not going to go over these in detail. The book sort of goes into some detail, but all of this is covered in AB 510. So if you don't know it now, you certainly will know it. And if you had 510, you should know it. Quite popular these days is the interview-informed synthesized contingency analysis, or the ISCA, that is described by Jessel, really described by Greg Hanley. This approach is gaining some traction in the field. It is still sort of controversial in the sense of having enough data to support its use. So, keep an eye out for that one when you see publications in JABA, or if you go to conferences, you'll probably see some folks debating the utility of this approach. Latency-based functional analysis, and you could even do a functional analysis of what we would call precursor behavior, that is, behavior that precedes more problematic behavior. So there are a variety of approaches. Again, my expectation for this class is not that you are aware of all of them, but maybe you could remember some. Again, the clinical scenarios that are described in the latter part of the chapter are well worth reading. It gives you an idea of different approaches to doing assessment for different types of problem behavior. So please do spend some time on those. With that, that is the end. I do want to highlight, however, that this is a very brief overview of a very comprehensive area. So this textbook only sort of scratches the surface, hence the reason why we have ABA 510 to devote to the study of functional analysis.